Authoritative GMLP language for AIML SaMD. Reviewer-ready phrases. Welcome! In this micro-lesson, you'll learn how to write SaMD documentation that sounds authoritative and aligns with FDA GMLP expectations. Our goal is to replace vague language with precise, verifiable statements that any reviewer can trace to evidence. When your claims are specific and testable, reviewers spend less time guessing, and you spend less time on rework. We'll show phrasing templates, examples, and common pitfalls so your submission communicates confidence without overpromising. By the end, you'll know exactly how to reduce ambiguity, strengthen credibility, and streamline the review process. Modal verbs shape perceived certainty. Prefer will over may or aims to. For example, the model will undergo quarterly drift monitoring is stronger than the model aims to be monitored quarterly. State commitments, not intentions. We will submit audit logs within 5 days, beats. We intend to provide logs promptly. Remove hedges like generally, typically, and as needed. Replace with measurable triggers. If false positive rate exceeds 8% for 2 consecutive weeks, we will pause deployment and retrain. Clear modality signals ownership, accountability, and readiness. Anchor the narrative with a crisp intended use. This SaMD is intended to, then specify population, setting, and outcome. Example: this SaMD is intended to assist board-certified radiologists in hospital settings by prioritizing adult chest X-rays with suspected pneumothorax for review within 15 minutes. Define boundaries to avoid misuse. Inclusions: adults 18+, PA or AP chest X-rays, and exclusions: pediatric patients, portable lateral views, trauma bays without PACS. Clear scope prevents clinical drift, clarifies validation needs, and guides risk controls and labeling. State data suitability with a direct template. Training data are representative of, for example, training data are representative of adult U.S. inpatient and outpatient chest radiography from 2018 to 2023. List sources: 3 academic hospitals, 2 community clinics, timeframes and demographics, age, sex, race/ethnicity. Address bias and missingness. We assessed label quality via dual reads, handled missing metadata with predefined rules, evaluated subgroup performance by sex, age bands, and race/ethnicity, and corrected sampling imbalance with stratified batching. Governance matters. Describe access controls, audit trails, and approvals for dataset changes. Be explicit about controls. Use: we will control drift via example. We will control drift via weekly stability monitoring, population shift detection, and alert thresholds that trigger model review. Document versioning. Model versions use semantic numbering. Training artifacts, code commits, and data hashes are linked in a changelog. Clarify locked versus adaptive models. Clinical release is a locked model. Any retraining occurs offline, requires validation against predefined gates, and follows change control before redeployment. These details show engineering discipline and protect clinical consistency. Make claims that reviewers can test. Template: primary endpoint meets. Example: primary endpoint, case level sensitivity meets the 90% threshold. Observed 92.1%, 95%, CI 89.0 to 94.5. Report metrics with confidence intervals and decision thresholds. Specificity 88.7%, 95% CI, 85.2 to 91.6, at a threshold of 0.62. Distinguish internal from external validation. Internal cross-validation shows model stability. External multi-site testing shows generalizability. State sample sizes and event rates so reviewers can assess power and uncertainty. Avoid cherry-picking. Present both strengths and known limitations. Link risks to safeguards. Template: user risks mitigated by. Example: user risks mitigated by on-screen explanations, triage flags, and forced acknowledgement of limitations. Describe safeguards: clear labels, confidence bands, alerts, quality checks for poor images, and overrides. Clinician can dismiss or re-queue a study. State monitoring and rollback. We monitor false alert rates weekly. If thresholds are exceeded, we disable prioritization and revert to the prior validated version. Tie mitigations to specific failure modes: misclassification, latency, or workflow interruption, so controls feel practical, not generic. Finish with a concise map from commitments to standards. Note commitments mapped to GMLP clauses: data quality, training/validation, monitoring, human factors. Show traceability from claim to evidence. Intended use: right-pointing arrow dataset, right-pointing arrow model, right-pointing arrow validation, right-pointing arrow labeling, right-pointing arrow post-market monitoring. Use plain, testable, reproducible language. Who does what, when, and how it's measured. Example: we will review drift metrics weekly and document actions within 3 business days. This structure invites quick verification, reduces follow-up questions, and demonstrates that your team is disciplined, transparent, and ready for safe, effective deployment.